It's your life, it's your heart. Smarter Heart University, your institution for higher heart learning without the confusion, where everyone can get a passing grade in life. Attend Smarter Heart University with Dr. Scott on AM 970, The Apple.
Good morning. This is your Smarter Heart University. I'm Dr. Scott, your host, along with my partner at Change of Heart Cardiology, Dr. Robert Kaiser, as my co-host. Good morning, Bob.
Good morning, Scott.
Just a small bit of housekeeping. This is going into our third month of shows. We passed 2 months already, and we love getting up every Sunday morning and doing this radio broadcast for you. And we just wanted to basically reach out to all of the people that are listening and let you know that we are here for you. Smarter Heart University is your place that you can get updated on everything medical on a regular basis. We have a Facebook site that you can sign up for, and we will provide that information as soon as it becomes available to the public, even before it reaches the news stations. We have a website, www.smarterheartuniversity.com. We encourage you to register as a member. We would love to be able to involve you in all of our discussions on a regular basis and form community groups. It is our job to bring you and update you on everything cardiovascular at as our introduction always says, higher heart learning without that confusion. Well, I certainly hope today's topic will stimulate you to call with any questions, 866-970-9622. 866-970-9622. As usual, we have a lot of information to provide to you this morning. So let's dive into today's popular question. Could one of my medications be affecting my sex life? They could, but perhaps there's a more underlying dangerous issue it is marking, that of vascular disease, folks. Erectile dysfunction, or ED, is itself not a life-threatening disorder, but it certainly affects the social interactions, the well-being, and the quality of life of its recipient. What we will show you today is how ED may be the first signal or an early warning beacon of very bad things to come. In a sense, ED may represent the tip of the iceberg underlying vascular diseases. Certainly, as men age, one can expect some degree of ED. But as we delve deeper into the studies involving the coexistence of ED and heart disease, it is hard not to realize just what is at stake here. Recognizing that ED is an early sign of vascular disease could have a significant, huge impact on preventative health care and its screening. If you think about this, such an easy and reliable method for doctors and patients to identify risk at a very early stage should not be overlooked. So here's some facts, because we always like to provide facts. At least half, that's 50% of men aged 40 to 70, and 70% over 70 experience some degree of ED. Up to 75% of men with documented heart disease of any type has some degree of ED, and that includes 60% of men who have a heart attack or bypass surgery have reported prior ED. Coronary artery disease, folks, will be the leading cause of world disability and the fourth most common cause of death by 2020. Currently, and this is scary, 140 million men worldwide have ED, with a projection of 322 million by 2025. Whew. Here's the worst part. The symptoms of ED predict the onset of heart disease a little bit over 3 years in near 70% of men. Anybody out there kind of shocked about that? So where does this evil association begin? Our key word here today, folks, is atherosclerosis. This is essentially damage to your lining of your artery with buildup of plaque. That's what atherosclerosis means. It is a systemic disease. And what does that mean? It occurs from head to toe. It occurs all over your body, and it's the most common cause of ED overall. The arterial lining plays such an essential role for a man getting an erection. What disturbs this lining and causes atherosclerosis are what I call and refer to the big six: the diabetes, high blood pressure, obesity, smoking, no exercise, and abnormal cholesterol. These guys affect every artery in your body, including your genitals. So why does ED seem to precede the symptoms and appearance of heart disease? Well, size does matter in this case. In this case, size or the diameter of the penile blood vessels would be likely to be first compromised and cause ED way, way before plaque would build up large enough in the larger coronary arteries or the peripheral arteries like the legs or the carotid to cause pain or any other symptom that you would get. It is also likely that atherosclerosis or plaque causes an alteration of a compound essential to every artery that allows it to dilate and improve blood flow. And that's called nitric oxide. So we'll call that NO. Again, just the same reason that atherosclerosis would, depletion of or alteration of this would affect the smaller blood vessels first, and in this case, the penile arteries. It is also this compound, folks, NO, that is brought back to life by the ED drugs, also known as PDE5 inhibitors, and in the process brings your sex back to life. So does ED mark the spot for heart disease? Well, it's really important for you to know that for every blocked artery in your heart, and the more severe blockages that you get, your ED gets worse. So it correlates. This brings up a concept of inflammation. If you did hear us on our cardiac markers lecture, our radio show last week, this whole concept that we talked about, that's where we use the analogy of the Pac-Man. Your immune system, Pac-Man, if you had enough of the swarm of these cells running around plaque, it's either going to build the plaque up or it's going to blow the plaque up. ED has been significantly related to many, many markers of inflammation in your body, get this, equal to that of heart disease. So if you have ED and you have a high marker, we talked about one called C-reactive protein last week, so you have a high amount of Pac-Man, it is best to establish your risk of heart disease as early as possible. ED, folks, increases your risk more than family history of heart disease or a personal history of high cholesterol. That's a fact. What do you think, Bob?
This is just putting into words stuff that I think we've known. To put it in context, we're talking about how small these arteries are. Everybody knows the inside of a ballpoint pen, those little thin tubes. That's the size of the arteries that we're talking about. I mean, this stuff is small. So any wonder that any little tiny bit of blockage leads to impaired blood flow, which is all an erection is just a lot of blood flow to the penis. It gets erect, and now you impair blood flow to the penis, and now you have problems. And as you said, this is blockages. This is a systemic process. It's occurring head to toe, everywhere possible. It's just focally manifests itself in different spots. And in this instance, because of the penile arteries are so small, it tends to occur there first.
Right. I mean, there was a lot of facts we just discussed there. There's a lot. And for all of you out there, it is our job to present the facts, but it's our job also to try to make it as easy for all of you to understand. And as we progress today, there's a lot of information. That's why it's so good that we do post all of this, again, within 48 hours on SmarterHeartUniversity.com. A lot of people come into our office and don't realize, I missed the show. Well, you can listen to this again and again at your own leisure, in your own time. Pause, rewind, etc. We have it up. You can download it as a podcast. It's also up, and we also videotape these, and we have it available with a link right via YouTube.
And if you have more questions, just get on the forum and start asking questions. That's what the whole point behind this is.
Good point, Bob. I mean, that's what we love. We know we're successful when all of you, we stimulate some concern or, hey, I didn't understand what you were saying. And again, we had some issues very early on when we first started. Some of you folks out there really did say, I didn't get that. What does this mean? Especially, we had a lot of talk when we did the atrial fibrillation radio show. And even comments that they would like us to do maybe a second one on that. But this ED is a big
it's a vascular
issue.
problem.
Yeah.
For in a large portion of patients, it's a vascular problem, and we're vascular doctors. So and the concern is, as I tell the patients when they have leg artery blockages, you're not going to die from this. What you die from is the heart attack that goes along with it. So it should wake you up. You should be talking to your doctor about this and bringing this up. So,
well, that's what we're going to talk about. So erectile dysfunction today is our main topic. We're going to go out with a pop quiz for Dr. Kaiser and everybody out there. High blood pressure and ED are closely related. ED is found in 25, 35, or 45% of patients with high blood pressure.
Oh, 45%.
Okay, so Dr. Kaiser said 45%. We'll be right back on your Smarter Heart University on AM 970, The Apple.